So how many people use their phone to send a text message today? Probably most of us, right? Now, I don't know about you, but my text messages often have typos. Or sometimes my phone autocorrects and just throws the wrong word in there. Now, most of the time, these typos are pretty small, and you can still understand what I'm trying to say. But other times, they're a bit bigger, and they can completely change the meaning of the message that I'm sending someone. In DNA, these typos are called mutations, and they're very common in diseases like cancer. Just like my text message, some of these typos are relatively small, and they don't change the instructions that a cell might receive. But others can be much larger. And when that happens, the message that a cell gets can be altered, and that can cause the cells to behave differently and maybe more aggressively than they otherwise would have. Now, we all know that cancer is common in people. Millions of people fight this disease every day. But what you might not be aware of is that animals develop many of the same cancers that people do, and they're often just as common. As a veterinary medical oncologist, I treat animals with cancer using many of the same anti-cancer drugs that a person might get. But for over 3 decades, our strategy for treating cancer really hasn't changed a whole lot. We give a chemotherapy drug to try and kill the cancer cells. And this approach works pretty well for a lot of cancers. While we don't commonly cure cancer in our veterinary patients, they do respond to treatment and are able to spend some extra good quality time with us. But not all cancers respond the same way to therapy. Why does treatment work for some dogs with bone cancer better than it does for others? What makes cancer in the bone different from cancer in the spleen or the heart? So I want you to think about your thumb for a minute. Just like my thumbprint is unique from all of yours, one of the things that makes cancer in one person different from cancer in another person is its genomic fingerprint. This fingerprint contains all of the genes that give instructions to cells, basically just telling them what to do, kind of like the words in a sentence. Think about it, your words are made up of a series of letters and your genes are made up of a genetic alphabet. And just like my text messages, your DNA isn't perfect. Sometimes it makes mistakes. Extra letters or words can be added in or deleted. So then what if we could identify those typos in cancer and give a drug that specifically targets those mutations? Well, as you might expect, this approach works well in some cases, but in other cancers, that same drug might not work as well, even if both tumors have the same mutation. Now, the reasons for this can be complicated, but it really boils down to 2 big overarching issues. The first is that cancer is just unpredictable. Not all mutations change the instructions that a cancer cell gets, and we're really only beginning to understand which mutations are the most important for determining if cancer will spread in the body or if it will respond to treatment. The second issue is that cancer can occur anywhere in the body, and a lot of the time it pops up in places that are hard for us to biopsy. And this is really important because if we can't get a piece of that cancer, then we don't know what its DNA fingerprint looks like. Now, something that's really interesting is that cancer can release pieces of its DNA into the blood. And by using advanced sequencing techniques to determine the order of letters in the cancer DNA and pinpoint those typos, we're beginning to identify the genomic fingerprint of cancer simply by taking a blood sample. And these strategies are useful for helping us to identify better treatment options for patients. We can compare the fingerprint of cancer in the blood to the fingerprint of the actual tumor from the time that it's first diagnosed to the time that it spreads somewhere else in the body, such as the lungs. Now, unlike my fingerprint, the fingerprint of cancer changes over time. And by understanding how this occurs, we're working to identify better treatment options for patients. And maybe most importantly, we can study how that unique genomic fingerprint affects how normal cells in the body interact with cancer cells during the course of therapy. All you have to do is look at your phone to realize that there are a lot of things we do differently now than we did 3 decades ago. I'm motivated to accelerate discoveries that can lead to new treatments for cancer, because for many of the cancers that we see, just like bone cancer, the prognosis hasn't changed for years. And that next discovery in a veterinary patient could not only improve the outcome for man's best friend, but could also be the thing that helps save your life or the life of a loved one. Thank you.